Good evening, everyone. I'm Andrew Joyce, Chairman of the Albany County Legislature, and welcome to the William J. Conboy Legislative Chambers. The governing law directs we hold a public hearing prior to the passage of certain legislation. In addition, the legislature's rules of order prohibit members of the public from questioning legislators and prohibit us from questioning you. This is your time to speak and our time to listen. Speakers are called in the order their names appear on the sign-up sheet, and speakers are permitted 3 minutes to express their views on the relevant topics. And I'd ask the clerk to please call the roll.
Beston. Bergdorf.
Here.
Chapman. Clay.
Here.
Cleary.
Here.
Collins.
Here.
Camiso. Cunningham. Demolowitz. Drake.
Here.
Efficoro.
Here.
Ethier.
Here.
Feeney.
Here.
Fine.
Here.
Grimm. Andrew Joyce.
Here.
Ray Joyce. Kuhn.
Here.
Lakakis.
Here.
Lockhart.
Here.
Muriello.
Here.
Mayo.
Here.
McLaughlin.
Here.
McLean Lane. Miller.
Present.
O'Brien. Purley.
Here.
Peter.
Here.
Plosky.
Here.
Reedy. Reinhardt.
Here.
Ricard.
Present, Madam Clerk.
Rosano. Simpson. Smith. Tunney.
Here.
Ward. Whalen. Willingham. $25 present.
Thank you, Madam Clerk. Madam Clerk, please read resolution number 487 for 2023.
Resolved by the County Legislature of the County of Albany that a public hearing on proposed local law number F for 2023, a local law of the County of Albany, New York, amending Chapter 106 of the Albany County Code, setting forth requirements for location of substance abuse treatment facilities within Albany County to be held by the Albany County Legislature at 7:15 p.m. on Tuesday, November 21st, with participation information to be made available on the Albany County website, and the clerk of the county legislature is directed to cause notice of such hearing to be published containing the necessary information in accordance with the applicable provisions of law. Affidavits of publication are on file in the clerk's office.
Madam Clerk, please read the first name.
Chris Asul.
Good evening, everyone. Thank you for giving me the opportunity to speak here tonight. My name is Christopher Cini. I'm a person in recovery, and I am the Director of Policy for Friends of Recovery New York. Friends of Recovery New York represents the voice of thousands of individuals, families, and families of loss, living in recovery or otherwise impacted by addiction, and we are here to voice our opposition to local law number F. Here are the facts. New York is in the midst of an overdose public health crisis. In totality, the country has lost more than 111,000 individuals to overdose in a 12-month period ending in April 2023. In the same period, New York State has lost almost 7,000 individuals, equating to roughly 19 people per day. As the nation's overdose deaths have plateaued, New York State's overdose deaths have continued unabated, increasing by roughly 10% annually, with the largest increases occurring in the BIPOC communities. Fentanyl and xylazine have infiltrated other drug supplies, leaving individuals vulnerable across the spectrum to overdose poisoning where they're opioid users or not. While at the Rensselaer County Heroin Coalition last week, they announced Rensselaer County had already broken its all-time high in fatal overdoses, and the capital region is on pace to do the same. It's with that backdrop that I find the disconnect between policymakers and the actual needs of the community shocking. Punitive legislation rooted in stigma, requiring providers to go through an onerous set of notifications to the community at large creates unnecessary barriers, reflects a distrust of patients, will exacerbate disparities in treatment access and retention, and sets a dangerous precedent, creating a legislative roadmap that will reverberate around the state and for other localities to follow. This legislation is a deterrent and will be seen as such by providers. We need to utilize all our tools in the toolbox to combat the public health emergency, expanding our treatment offerings, and removing unnecessary barriers so people can access life-saving treatment for substance use disorder. Individuals and families impacted by addiction requires an all-hands-on-deck approach. We trust that our elected leaders will do everything in their power to expand access and investments to overdose prevention, treatment, and recovery services and supports necessary to address this public health crisis in word and deed. New Yorkers deserve the reality of recovery, not just a hopeful possibility. Thank you.
Joelle Foscat. After her, there's no more speakers after her.
Is there anyone else in chambers who would like to speak on resolution number 487 for 2023, local law F for 2023? Hearing none, the public hearing on local law F for 2023 is now closed. Madam Clerk, please read resolution number 447 for 2023.
Whereas Section 604C of the Albany County Charter provides that a public hearing on the proposed legislative additions and/or deletions to the tentative annual budget shall be held not later than December 1st, now therefore be it resolved that the Albany County Legislature will hold a public hearing on the proposed legislative additions and/or deletions to the 2024 tentative annual budget with participation instructions available on the Albany County Legislature website at 7:15 p.m. on Tuesday, November 21st, and the clerk of the legislature is directed to cause notice of such hearing to be published containing the necessary information in accordance with applicable provisions of the charter. Affidavits of publication are on file in the clerk's office.
Please read the first name.
Susan Cotner.
I'm Susan Cotner. I'm with the Affordable Housing Partnership and the Albany Community Land Trust. We're here tonight to call for the creation of a dedicated, flexible housing fund to support the development and preservation of affordable housing throughout Albany County. We believe that Albany County has an historic opportunity to not only reduce property taxes, but also invest in its tax base. Investing in a housing trust fund that serves neighborhoods throughout the county that will build up housing values through home repairs, renovations, and construction of new units. This is an economic development and an affordable housing crisis that we've got going on right now. Seat Center, one of our job training partners, tells us that the #1 barrier for new workers that they're trying to help get good jobs is housing stability. That's the #1 problem because kids don't know where they're going to go home and sleep. They don't have a home, right, to go home to at night. Housing for minimum wage workers at $15 an hour, not available. That's $850 a month that somebody can afford earning minimum wage. The average rent, the median rent right now for a one-bedroom apartment in Albany County is $1,250. That's affordable to somebody earning $45,000 a year. Homeownership is difficult to attain for first-time buyers. Right now, according to census data, 44% of Albany County residents are paying more than 35% of their income for rent. Well, that doesn't leave a lot of room for saving for a down payment. So even if you do earn the median income in Albany County, which is about $89,000, you can afford a house of about $250. A median price of a home for sale in Albany County right now is $300,000. So there's a huge gap in terms of what families that are working, earning income, wanting to live, work in Albany County can afford. An ongoing dedicated source of revenue could fund repairs to existing homes to keep them livable and affordable. It could pay for the cost of renovation when rehab expenses exceed the amount that you can borrow. Right now, the land trust finds that it costs us about $250,000 to $275,000 to rehab one of those vacant lighting houses. We can only get financing about $125,000, so we've got a big gap in terms of finding the money to get those repairs completed.
30 seconds.
Housing funds are being established throughout New York State right now, as other localities are seeing increased revenues through sales tax revenues, right? As we've had inflation go up, so too have revenues coming into the counties. While an across-the-board property tax rate reduction does help folks, everybody wants property tax reduction, it doesn't really directly help tenants in affordable and low-income units. So we are asking that a dedicated fund be created to help more families afford to live in Albany County. So I think you're at a unique, historic moment, thanks to the leadership of this body and the county executive in having a sound fiscal approach. You can do both. You can reduce the tax rate, and you can also create an ongoing dedicated revenue source to help create more affordable housing in the county. So we appreciate your consideration of this opportunity. Thank you.
Valerie Mosley.
Good evening. Thank you for allowing me to speak. My name is Valerie Alexander Mosley. I purchased my home in the city of Albany approximately 30 years ago. Things have changed so much. Every day at my job, I'm trying to help people find housing, find an apartment, buy a house. As soon as they hear that the Albany Community Land Trust is building a house, the house is sold before it's even done. Because if we do 6 homes, build 6 homes, we got at least 30 people coming for those 6 homes. And it's only 6 are gonna get it, so we have so many people that are disappointed because now they're still waiting to get an affordable house. Apartments, I get like 6, 7 applications for apartments every day, every evening, I'm showing apartments. But I have to show them to many families because there's many families looking to watch and see who's moving out of an apartment, who owns the apartment, and they're coming straight to the Albany Community Land Trust. So the Housing Trust Fund is needed, it's much needed. It's needed right now. Now is the crisis, and now we have to do something to fix it. So we need that to raise more funds from new sources of revenue on an annual basis for the development and preservation of affordable housing in Albany County. People don't want to move out of Albany County. We tell them that they might get an apartment in Schenectady, they may could get one in Troy, but they grew up in Albany County and they want to live in Albany County. People love Albany County. I grew up here. I love Albany County. So, you know, we just want to fix this problem. We've been stretching our money. We have limited funding for grants. The rents from tenants to develop new homes and preserve existing units are below market sale prices and rents. So I just ask you to really think about it. Think about how we can fix this, because now is the time to try to work together and fix it on all levels. I have a young lady that came to me the other day who was living out of her car. And I'm sure everybody heard about her this summer, how she went all over the city of Albany providing fried dough for kids, moving her truck all around the city of Albany. But at night, no one knew that she didn't have a home to go to. She lived out of her car. She didn't have a job, but she did the best that she could because she loves Albany. So these are the kind of people that we need to help. But, you know, thanks be today, she's in an apartment and she's in our workforce development program with the iron union workers, and she's doing well. So these are the kind of people that need our help. So I ask you to just really focus on providing a housing trust fund for the city of Albany. Thank you.
Maria Markovics. Oh, it's Roger. Sorry, Roger.
I guess my wife would keep calling in and register the.
Okay. It's actually Roger.
Okay, I've been here before, including last week, and so I won't bore you. I'll try and make it different than I said last week, but still be on topic about the need for a housing trust fund. Last week I mentioned that there had been, the county had set up a housing trust fund in 2006, 7, and 8 with money from the sale of foreclosed properties, and in 2008 the Great Recession happened and the bond fell out of the market. A lot of speculation housing, a lot of subprime lending going on that were really predatory loans made to a lot of people who end up losing their houses. Anyway, getting back around to the need for affordable housing trust fund was eclipsed by the development of the land bank, county land bank, which has been great. But that didn't bring funding to all the organizations that want to use this and have people who want to buy a home through the land bank or to want to rehab it. And so there are programs out there that the Land Trust, Albany Community Land Trust, has utilized. We've been here, been in existence for 34 years now. We've done 80 some odd buildings, and we sold about half of them. The other ones are renting them out. And but it's like every year it's like what's funding is available, and how do we combine with this funding source with that funding source to make these things work? And there's always stuff that doesn't fit in there, and so we are bound by the difficulties of making this money stretch. Valerie alluded to this. She was president of our board for about 15 of those years, and our board meetings were about, okay, what are the repairs we got to do? What are the new projects we want to do? And where's the money going to come from? The grants don't cover everything, and there's always a lot of gaps. In fact, a lot of funders want to see us raising other money to match theirs and stuff. So the Housing Trust Fund would answer much of this, and it would enable us to grow. We're working together with a lot of organizations, the Community Loan Fund, the United Tenants, Habitat and the Land Trust are now working together on some buildings on Lower Sheridan and Lower Orange and on the ID Yarborough site. But so we're working with everybody who we can, and we've been working with city and county governments and stuff, but we need more money from different sources. This is what a housing trust fund is about. It's about raising money from new sources and new sources that will replenish every year with continued funding. So the funding, hopefully will be stable to work with, and hopefully will grow with newer funding sources as well to add to it. And that's how we can meet all the need. There was articles in the paper about, well, Susan mentioned about like $250,000 or $260,000, I forget how much it is, it costs to rehab a house. And so Habitat's the same way. They have to come up with about the same kind of money to build a house. So anyway, that's the need we're talking about, and we want poised to work with you. And it should be a city and county housing trust fund, and I know that the city legislators are supportive of this as well. Okay, thank you very much. Appreciate it. Sorry for going over.
Laura Travinson? Laura? No. There are no more speakers.
Is there anyone else in chambers who wishes to speak on the legislative additions and deletions for the 2024 proposed budget? Hearing none, the public hearing on resolution number...
Mr. Chairman, I think that's speaking about this.
Hang on a second, folks. Hang on. Ma'am, are you here to speak about the budget? No. I didn't think so. Hang on 1 second. Hearing none, the public hearing on resolution number 447 for 2023 is now closed. At this time, I'd like to take a motion to reopen the public hearing for local law F. Motion by Mr. Coons, second by Mr. Peter. All those in favor? Aye. Opposed? We're going back to the first public hearing, okay? Come on up, 3 minutes. Thank you.
Sure. I'm right here.
Oh, that is
Yep.
full. Okay.
I'm here today to voice my opposition to Local Law F. Although modifications have been made, all the fundamental problems remain the same. This law is still a violation of the Americans with Disability Act, and carving out Camino Nuevo as a provider moving within a municipality acknowledges exactly what we have been saying all along. This is a process that is designed to fail. This legislation perpetuates stigma, and stigma kills. But sometimes saying that phrase doesn't feel strong enough, so I want to illustrate exactly how this can be the case. I've met so many heartbroken parents who have lost loved ones to overdose. They say things like, "I wish I had known sooner," or "I wish we could have found the care my child needed." But their kid would rather take their life in their own hands than be looked at as one of those people by their parents. Or they can't find the care they need because of too much community outreach or outcry about a provider coming to a community. After a domestic incident and spending several days in the hospital, my cousin begged to go into treatment. Her doctor told her, "You don't need treatment, you need a new boyfriend," because she didn't look like what addiction looked like in his mind. She died by overdose 2 months later, and this is how stigma kills. So now a portion of the work I do involves engaging elected officials who allege that OASIS providers are the reason for a number of problems their city or community is facing. They cite a negative ripple effect, and studies show that the impact of an addiction care provider on crime is equal to a liquor store and less than a convenience store. So this broken window theory they're alleging doesn't pass muster. There is, however, a ripple effect on families when addiction care is not available, and those impacts are felt for years. Parents lose children, children lose parents, and we lose having some exceptionally kind, warm, and loving humans as part of our community. Thanksgiving is only a couple days away, and I would ask that you practice gratitude for the struggles you are not facing, vote no on Local Law F, and show kindness and compassion for those who struggle with a chronic disease you are fortunate not to know.
There are no more speakers.
Is there anyone else in chambers who wishes to speak on Local Law F for 2023? Or Resolution number 447 for 2023? Anybody? Questions, comments, concerns? Now's the time. At this time, I want to wish you all a happy Thanksgiving. Thank you for all you do. Have a motion to adjourn. Motion, Ms. Peters, second, Ms. Ricardo. All those in favor? Thank you, everybody. Safe home.